and shunts are both devices used to manage various health conditions, but they serve different purposes and are used in different contexts. Here's a breakdown of their differences, uses, and methods of application. Stent. Definition. A stent is a like device to a narrowed or blocked vessel to keep it open. Uses. Cardiovascular applications. In cardiology to treat narrowed coronary arteries, coronary stenting, to improve blood flow to the heart muscle. Other applications. They can also be used in their body ureters to help obstructions of arteries. Stents and shunts are both medical devices used to manage various health conditions, but they serve different purposes and are used in different contexts. Here's a breakdown of their differences, uses, and methods of application. Stents. Definition. A stent is a small, tube-like device that is inserted into a narrowed or blocked blood vessel or duct to keep it open. Uses. Cardiovascular applications. Stents are commonly used in cardiology to treat narrowed coronary arteries, coronary stenting, to improve blood flow to the heart muscle. Other applications. They can also be used in other parts of the body, such as in the ureters, to help with urinary tract obstructions, or in peripheral arteries. How they are used. 1. Insertion. Stents are typically inserted during a minimally invasive procedure called angioplasty. A catheter with a deflated balloon is threaded through the blood vessels to the site of the blockage. The balloon is then inflated, expanding the stent, which locks it in place. 2. Material. Stents are often made from metal or a polymer and may be drug-eluting, coated with medication to prevent restenosis or re-narrowing. Shunts. Definition. A shunt is a device or procedure that creates an alternative pathway for fluid flow, typically to redirect bodily fluids from one area to another. Uses. Neurological applications. Shunts are commonly used in neurosurgery, particularly for treating hydrocephalus, accumulation of cerebrospinal fluid in the brain. A ventricular shunt can divert excess fluid from the brain's ventricles to the abdomen. Vascular applications. Shunts can also be used in vascular surgery to bypass a blocked artery or vein. How they are used. 1. Insertion. Shunts are surgically placed to redirect fluid flow. For example, in the case of a ventricular shunt, a catheter is inserted into the brain's ventricles, and the other end is placed in the abdominal cavity or another area where the fluid can be absorbed. 2. Types of shunts. There are various types of shunts depending on the specific condition being treated, such as biliary shunts for liver conditions or cardiac shunts for congenital heart defects. Key differences. Function. Stents are primarily used to keep blood vessels open, while shunts are used to redirect fluid flow. Application. Stents are typically used in vascular situations, while shunts are used in various contexts, including neurosurgery and other fluid management scenarios. Insertion method. Stents are usually inserted via catheterization, whereas shunts often require surgical placement. In summary, while both stents and shunts are essential tools in modern medicine, they serve distinct purposes and are used in different clinical situations. If you have more specific questions about either device, feel free to ask.